Hi folks, welcome to this video on the long-term effects of training on the cardiovascular and respiratory systems. This video is to help you do P4 of the Physiology of Fitness unit and to complete the second half of M2. So it's pass and merit. And again, pass, if you're going for passes, which you shouldn't be, it's basic descriptions. Merits, which you should be going for, are your detailed explanations, giving examples, things like that. What we are looking at here in terms of long-term effects, we are talking, let's give an example. 8 to 12 weeks of training, what will have changed in your cardiovascular, your heart, and your respiratory, your lungs? If I sent you 8 to 12 weeks altitude training with, Mo Farah, someone like that, what will have changed what changes will have taken place to both of those systems? That is what we are going to cover in this video. And again, remember, get the detail down. This video is just a guide. Do a bit of background work on it to make sure you pad it out to get that extra detail to get the merit criteria. Right, so probably the one that we're all most familiar with is hypertrophy, however you want to pronounce it. But in particular, in this case, it is cardiac hypertrophy. So it's well worth remembering that. We can have normal hypertrophy of our skeletal muscles, but cardiac hypertrophy, what is it? Well, you know what it is. As the heart undergoes hypertrophy, the heart increases in size and strength. Your heart gets bigger, your heart gets stronger, okay? Now, you might think the heart hypertrophy is all equally. It's mainly the left ventricle that gets bigger and stronger. Think about what the left ventricle does. That's the chamber that pumps blood around the body. So that's the one that's going to deliver the blood to the working muscles. So it's massively important that that's the chamber that gets bigger and stronger as opposed to all of the rest of the heart. So we're looking at, if we look on the diagram, we're talking about this chamber, the left-hand side of the heart, the bottom chamber. This is the side of the heart, the chamber of the heart that will undergo the most cardiac hypertrophy. What are we going to see as a result of that? Well, we're going to see increased stroke volume. Now, what is stroke volume? It's the volume of blood pumped out of the heart per beat. In other words, through training, we are going to be able to pump out more blood out of our heart per beat. If our left ventricle, don't forget, the one that pumps blood around the body or to the muscles, if that's got bigger and stronger, it can hold more blood and it can force more blood out. So we're going to increase our stroke volume. What's the benefit of that? Well, if I can pump out more blood per beat, I can deliver more oxygen and I can deliver more nutrients, glucose, fats, proteins, vitamins, minerals. If I can pump out more blood per beat, I can pump out all those extra things that the blood is carrying, which is going to benefit me as a performer. What else is going to change? Well, I'm going to have an increased cardiac output. Now, where does this link in? Cardiac output is the volume of blood pumped out of the heart per minute, which is therefore worked out by calculating your stroke volume, how much blood can I pump out per beat, and multiplying that by how many times my heart beats per minute. So I'll put that there in little brackets. That is the volume of blood pumped out of the heart per minute. You know, going back to stroke volume, that's the volume of blood pumped out of the heart per beat. Cardiac output is the volume of blood pumped out of the heart per minute. That is the only difference between the two. So that means I can deliver more oxygen and more nutrients because there's more blood going around my system per minute now. Yeah, delivering all those vital things to the tissues, to the organs, things like that. What it's worth saying is that an increase in cardiac output comes mainly due to an increase in heart rate, okay? So yes, as we previously mentioned, stroke volume does increase, but it doesn't increase by a huge amount, but it does increase. The main changes, the main increases in cardiac output come about due to an increase in heart rate, particularly maximum heart rate, which remember, MHR, maximum heart rate, equals 220 minus your age. So if you are 20 years old, you can get your heart rate up to around about 200 beats per minute. Typical resting heart rate is between 60 and 80 beats a minute, but you could get your heart rate up to 200 beats a minute. So when we increase our heart rate, okay, by a lot, and our stroke volume by a small amount, That leads to an overall much bigger cardiac output, which means the volume of blood pumped out of the heart per minute increases and allows us to deliver a lot more oxygen and a lot more nutrients. Finally, for this slide, we've also got decreased resting heart rate. Don't forget, that's one of the most common methods we use to measure your fitness. What is your resting heart rate? As you get fitter, we should see that your resting heart rate gets lower. Okay, now link it back to what we've just said here about stroke volume. Stroke volume, that increases as you get fitter. Why does it increase? Because the heart has got bigger and stronger, therefore it can pump out more blood per beat. If I can pump out more blood per beat, my heart doesn't have to beat as often. It's that big and strong that it doesn't have to beat as often as it used to, which is massively beneficial. Your heart's going to last you longer with regards to that. You know, it's a muscle, it's going to last you a lifetime. If you don't have to make it do loads of work at rest, it will last you a lot longer and your life expectancy increases. So getting a decreased resting heart rate is very, very important. So what I've put there, as stroke volume increases, resting heart rate decreases because your heart doesn't have to beat as often. If I can pump out more blood per beat, my heart doesn't have to beat as often as it used to. Brilliant. Great indicator. So basically, whenever you do a resting heart rate and it's nice and low, what that is basically telling you is your heart is big and strong. It has undergone cardiac hypertrophy. Because your heart is big and strong, it can pump out more blood per beat, which means it doesn't have to beat as often. Brilliant. Fantastic. And a phrase that you're familiar with from previous unit, bradycardia. If you've got a resting heart rate of less than 60 beats a minute, you are bradycardic. If you have bradycardia, that's telling us that you have cardiac hypertrophy. Your heart is big and strong, therefore it doesn't have to beat as often. Bradycardia is a really good thing. We would love everyone to have bradycardia. It shows that their heart is big and strong, therefore it doesn't have to beat as often. Right, there are 5 more key adaptations of the cardiovascular system. The picture here is representing one of them, okay? I'm going to change my pen colour slightly because it's been a little bit samey. Right, here we go. Now again, these are very brief, concise notes. You know, this is note form. Through training, we will get increased capillarization, right? Remember back to your blood vessels work. What are capillaries? They are the tiny blood vessels that carry blood through muscles. So these are the tiny blood vessels. They are no thicker than a hair on your head. They are tiny, they are microscopic, and they carry blood all through your muscle tissue and through your organs. Through exercise, we will build more of these capillaries. If we've got more of these capillaries, it means we can transport more red blood cells through the muscle tissue. Now, don't forget, what are the blood cells carrying? They're carrying oxygen. So I can deliver more oxygen into the muscle tissue. But equally, don't forget, when these red blood cells have dropped off the oxygen, what are they then going to do? They're going to pick up the carbon dioxide, they're going to get lactic acid into the blood, and they're going to remove it from the muscles as well. So building more capillaries is going to lead to greater oxygen delivery and a greater removal of carbon dioxide and lactic acid. So that's brilliant, but look at this. Not only are we going to get that, we're also going to get more blood volume. Your body is actually going to build more hemoglobin, more red blood cells, so I can carry more oxygen to the muscles. So not only have we now got more capillaries, more blood vessels in which to carry blood, we're now producing more of these little fellows, chaps and chapettes, these little red blood cells, these hemoglobin molecules, that are carrying the oxygen. So I can transport more oxygen to the working muscles, okay? Not related to this, but that's what Lance Armstrong was guilty of. He was found guilty of injecting a substance called EPO, which artificially increased the amount of red blood cells in his body, which meant he could carry more oxygen, hence why he did so well at the Tour de France, an aerobic event. You can increase the amount of red blood cells in your body naturally, just through normal training. It's just that he was using an illegal substance to increase them even further. But we will increase the amount of hemoglobin or red blood cells so we can carry more oxygen to the muscles. We will also see a reduction in resting blood pressure. So you will have a lower blood pressure when you are at rest. Your blood pressure will increase when you exercise. That is perfectly normal. That is perfectly safe. So it does increase during exercise, but when you are fitter and healthier, it will return back to its resting levels very, very quickly, which is a good indicator of your fitness level. But you will also lower it as well in the long run. If you've got a low resting blood pressure, there is simply less stress in your body's blood vessels. Remember, blood pressure is the force at which blood is travelling through your blood vessels. If you've got a low blood pressure, they are travelling through with less force. It means the blood is flowing more effectively, okay? And that means that you are generally healthier. Right, number 4 of 5 then is a decreased recovery time, okay? Now, we typically measure this by seeing how long it takes your heart rate to drop back down to resting levels following exercise. So let's say you've got a resting heart rate of 60 beats a minute, and during a treadmill run, you get it up to 160 beats a minute. We'll then stop you and see how long it takes to get back down to 60 beats a minute. The quicker it takes you to do that, the fitter you are, because what it's showing is that your heart is more able to respond to the situation, i.e. I need to be fast, so let's get very fast very quickly. Oh, I've stopped now and I need to drop down to resting levels, let's drop down very quickly as well. So the quicker your body does that, the quicker your heart does that, the fitter you are. And we typically do that by seeing how many minutes it takes your heart to return to resting levels after exercise. Some people can get their heart rate from 200 beats a minute back down to resting within 2 minutes. That is a very, very fit person who can do that, but it is certainly possible. Equally, there are those people who can get their heart rate only moderately high, 140 beats a minute, and it can take 4, 5, 6, 7 minutes for it to drop back down to resting levels. That's a sign that they are very unfit. Okay, so that's another long-term adaptation of the heart, the cardiovascular system, to exercise. So to sum it all up, by all these adaptations that we've just mentioned now, you are going to get increased aerobic fitness. Remember, what does aerobic mean? It means doing things with oxygen. So what you're going to have as a result of all this training, your heart and lungs are going to be more efficient. They're going to be able to do their job better with less effort. You're going to see an increase in your aerobic endurance, also known as stamina. Okay, so all these adaptations that we're talking about here are going to benefit your stamina, your endurance. You're going to be able to perform activities for longer with less recovery needed in between, which is fantastic. And as we said, it's going to benefit all you games players and all you endurance athletes. Okay, so if you fall into those two categories, or one of those two categories, you need to be doing lots of aerobic based training to get all the adaptations we've just mentioned over the last 10 minutes or so. Okay, these are all the things that you need to do to improve your cardiovascular system. Okay. Finally then, there's no point in making the heart and the blood vessels bigger and stronger and more efficient if we're not going to do the same to the lungs. We've got to make the lungs more efficient. We've got to improve them. This is a lot brief. There's only 4 adaptations we need to know for the respiratory system. Okay, but just as a reminder, remember the respiratory system is referring to the lungs. Right, number 1 then. Right, increase vital capacity. What is your vital capacity? As it says there, it's the maximum volume of air that can be breathed in and out during exercise, right? The more oxygen, the greater my vital capacity, I can take more oxygen in, I can therefore remove more carbon dioxide. In this graph, this is your vital capacity here. Okay, this black arrow that I'm circling here, that is vital capacity. What is this graph showing? If you follow it, I'm breathing in, I'm breathing out. I'm breathing in, I'm breathing out. I'm taking a maximum breath in, breathing as much as I can, and then I'm breathing it all out again. So lots of oxygen taken in, lots of carbon dioxide removed. So that arrow is representing the top of the breath in, right to the bottom of the breath out. I will increase this arrow, this wave. Let's actually draw it on. What will happen through training is this wave here, let me get a better pen, we'll do this, it will get bigger there and it will get deeper there. That is what is going to happen through training. Your vital capacity is going to get bigger. I can take more oxygen in and I can remove more CO2 per breath. That is going to be absolutely massively beneficial to me as an endurance athlete, as a games player. What else am I going to see? Well, I'm going to see increased minute ventilation. Okay then, so what is minute ventilation? Well, minute ventilation is tidal volume times breathing frequency. Right, what the hell does this mean then? Tidal volume is the amount of air breathed in or out per breath, right? So let's just write that underneath just to make sure. So that's the air breathed in or out per breath. And what is breathing frequency? Is the number of breaths per minute. So if I times how much air I breathe in per breath by the number of breaths I take per minute, I've got my minute ventilation, the volume of air I breathe in or out per minute, hence why it's called minute ventilation. That is going to increase as I get fitter and stronger. Well, through training, what is training going to do? It's going to increase my tidal volume. I'm going to be able to take in more air. I'm going to take in more air per breath. So I'm going to have a bigger tidal volume. So that's going to increase, okay? What else is going to increase? If I'm fit and strong, I'll be able to take in more breaths per minute because I'm used to it. My body's adapted. It's got stronger. The breathing muscles have got stronger. So if I can take on board more air per breath and I can breathe more times per minute, I'm going to increase my minute ventilation. Training increases tidal volume and can train the athlete to be able to take more breaths per minute, and that is going to lead to an increased minute ventilation. Now what I've just quickly done there is this one here, increased breathing frequency links with another adaptation. Just as your skeletal muscles get stronger through training, so will your breathing muscles. Think back to your anatomy and physiology unit, which were the main muscles involved in breathing. Well, the diaphragm was one, okay, and your intercostals, your external and your internal intercostal muscles, okay. So through training, those muscles are going to get stronger. That means you can now contract these breathing muscles with more force, allowing the rib cage to expand more and expand quicker. That's going to allow you to breathe faster, but it's also going to allow you to breathe deeper. So I should have actually also put that there as well. Okay. If I can make my rib cage as bigger than I normally could do, I'm going to be able to increase my tidal volume. I'm going to take on board more air per breath. But if I can also make the rib cage bigger, quicker, I can breathe more often per minute. So that's very, very important. So the muscles, the respiratory muscles are going to get stronger just as muscles are. We've had cardiac hypertrophy, the heart muscle getting stronger. We've had hypertrophy of your skeletal muscles. Now we've got hypertrophy of the respiratory muscles as well. Finally then, a diagram you're probably familiar with from the last unit we did is to do with diffusion. So what we've got here is, there is an alveoli in the lungs, okay, and there is a capillary, a blood vessel, travelling very, very close to the alveoli, again in the lungs. Here are our red blood cells, our hemoglobin, okay, and here's the oxygen we've just breathed in. Through a big deep breath, we've got lots of oxygen into the alveoli. Right, let's remind ourselves of a key word. Right, diffusion then. Gases are always going to move from areas of high pressure to low pressure. Force of nature, okay? That's exactly what's taking place here, okay? So the oxygen is very, very high in the alveoli, so it is naturally going to diffuse into the bloodstream where the oxygen concentration is very, very low, okay? So that is what oxygen is always going to do. At the same time, don't forget, CO2 is going to diffuse the other way. It's going to diffuse from the bloodstream into the alveoli so we can then breathe it out. Okay? So let's draw that in to remind ourselves. CO2 is going to diffuse from the blood into the alveoli. Oxygen is going to diffuse from the alveoli into the bloodstream. Okay? So what does training do then? Well, quite simply, it causes an increase in the number of alveoli. You've got something like 6 million alveoli in your lungs. You will increase that. You will increase the number of alveoli in your lungs. You will also increase the amount of hemoglobin in your blood. We've already mentioned this. Okay? You will also increase the number of capillaries, increase capillarization. We've already mentioned this. What is that going to result in? It's going to result in more oxygen diffusing into your bloodstream and more carbon dioxide diffusing out of your bloodstream, and that is going to make you better equipped to be able to handle stamina and endurance-based events again. So these are all key physiological adaptations that are taking place in your body through training. This isn't going to happen after one session. As we think back right back to the start, all the things that we've mentioned in this slideshow, we're talking about weeks and months of training. They're going to take a while to develop. Okay, this isn't over one session, but these are all adaptations that your body is going to undergo through endurance-based training. Okay? As I said, the information here is pass level stuff. You need to expand on it, get a bit more background information in order to turn it into merits. Okay, watch this as many times as you need to, folks, and good luck with it.